Are there any other things you want to bring up before we go into questions?
No, let's go to questions. I think we have some already in our queue here.
Okay. Chad?
Absolutely, yes. We have a question. What do you think about the Pfizer vaccine developed with the German biotech firm?
Right. So we already, we've discussed that, and I think that it is potentially very promising, but there are still, I'm very much in a wait and see mode. And there's also, incredibly challenging questions about distribution because it has to be kept at a very cold temperature. So there's cold chain and distribution issues. So I think we're going to see a big global fight over these vaccines, is my prediction.
In terms of who gets it and who gets
Absolutely.
it when.
Absolutely.
Okay. We have another question. Why have the U.S. drug companies not attacked piracy by Ranbaxy at all?
That's a good question. It's become very difficult for brand name companies to criticize generic drugs. We're in an era where they've been hauled in front of Congress and questioned about their drug pricing schemes and their salaries and their private jets. So it's kind of political suicide for any big pharma CEO to be attacking generic drug companies. But also, there's less of a distinction now between brand companies and generic companies. Brand companies have generic subsidiaries, or they're buying up generic companies. And also the global supply of active ingredient. The brand companies are getting their fine chemicals and active ingredient overseas, just like the generics companies are. So there's it's not so much an us versus them situation anymore as it used to be.
I want to say there's a lot of shocking things in your book, but one of I thought the absolutely most shocking was the idea that drugs that were really, in essence, really badly produced, and they didn't even try to sell them in the U.S. They sold them in Africa.
Absolutely. So that was like, of all the things that really surprised me in the course of my reporting, it is pretty standard in the generic drug industry to do something called dual track production, or row A, row B production. And what that is making different levels of quality for different markets. So, naively, I, going into this reporting, just assumed that a pill is a pill. And if you get, a generic Lipitor made by Mylan in the US, it would be the same as generic Lipitor made by Mylan in Africa, but not so. A lot of these companies engage in dual track production. They'll use lower quality ingredients and manufacturing shortcuts, and even manufacture the pills in different factories. So I've seen, factories overrun with monkeys and bird droppings, and those drugs, which would never pass muster, with a U.S. inspection, would be sent to Africans, which is just diabolical. It's just awful.
We have some other questions in the queue if you're ready.
Sure.
Do you think the Chinese would have been capable of developing COVID-19 as a biological weapon?
Wow. Probably yes, would be my guess. Now, did that happen? Obviously, there's been so much speculation and reporting about that. I don't have any evidence that that's the case. But I don't think it's out of the realm of possibility, given what we know about, chemical, chemical weapons manufacturer and whatnot. I mean, certainly it would be very on brand for 2020 if we find that out.
Okay, next question is how difficult and expensive would it be for American pharma companies to reestablish control over their supply chains?
That's a huge question. And it's really a big question now in the US because the US is trying to push towards what they call reshoring, which is, bringing manufacturing back to the US. There's a lot of obstacles to that. One is that making pharmaceuticals is actually a really dirty business. There's a huge output of pollutants, antibiotic tainted water. There's a lot of environmental contamination from pharmaceutical manufacturing, and it's had a horrible impact in India and China. So given the more restrictive laws in the US related to that, it is very challenging. There are some sort of advanced kinds of manufacturing. It's called continuous manufacturing that might reduce that sort of output of pollutants that might make it more possible. But what you really need is a massive government intervention to try to rebuild US manufacturing.
And I get a sense that, when it's all happening very quickly, but a lot of the talk about reshoring has really been about things like masks and swabs and, very simple personal protective stuff, and even ventilators we know about. But it's, you don't get any sense that Congress is moving in any way to make, or do you think that's?
Well, I mean, there is a lot of bipartisan support for this, which the COVID really kind of lit that up because of the national security risks of being dependent on these overseas countries. But you might recall there was this just fiasco where Jared Kushner's college roommate, who now runs something called the Development Finance Corporation, which is like a overseas bank embedded within the US government, and they made a huge loan to Eastman Kodak to start manufacturing active ingredients for pharmaceuticals in the US. And within days of the announcement, the whole deal blew up because of allegations of, shady stock trading by Eastman Kodak executives. So that was the Trump administration's signature effort at reshoring. But maybe, who knows? I mean, maybe that's like a first step that went badly, and we'll see more of that without the stock trading shenanigans.
But you're saying that to actually do that with pharmaceuticals, with the ingredients, would be an incredibly big and expensive task.
Absolutely.
And obviously, what the question is, what will that mean not only for the safety of drugs, but also for the cost of drugs?
Yeah, absolutely. It is very, very difficult, and you'd need like an all of government effort to make it happen.
Okay, we do have a couple of other questions lined up. A listener says, cannot wait to read your book. How worried are you about the Pfizer vaccine being counterfeited?
I have almost no doubt that it will be counterfeited. I mean, it's like almost certain. However, I do think that there will be intense security around it. I don't know what kind of efforts they're going to make to authenticate it with barcoding and all kinds of stuff like that. I mean, I'm sure they're building in a lot of security features to its labeling. But where there is that much money on the line, I'm sure there will be counterfeiting attempts.
There'll be somebody on eBay promising to sell you the vaccine.
Well, the problem is, I mean, I wrote my first book was all about counterfeits and the legitimate drug supply, but it's not going to be too encouraging if somebody is selling COVID vaccine from their pickup outside of a pizza parlor, especially when it has to be kept in this secure cold chain. That's the, that's the real.
And it's like, what
clincher
is it,
there.
70 below zero or
Yeah,
something? I
it's
mean,
like nuts. So, anybody who's saying that they got a super secret deal and, they've got some COVID vaccine in the back of their truck, in a beer cooler or whatever it's going to be, that's likely not going to have been maintained in a perfect cold chain. We'll see about that.
Okay, we have another question. Tell us more about what capabilities would have been necessary to make COVID-19.
Oh, that's so interesting. You know, I mean, not to kind of repeat conspiracy theory. I mean, I guess there was an infectious disease laboratory inside of China that was not far from the Wuhan seafood market. So that was sort of one of the things that I think prompted a lot of this speculation. But I think, one of the questions would be, I mean, there are coronaviruses that have been around and about, but the question, I guess, with weaponizing a coronavirus is how could you make it, perfectly infectious through airborne transmission, which is how you would turn it into a kind of weapon.
and you would have to infect
Yeah.
your enemies, but protect your population. I mean, right? In theory.
Presumably.
Yeah,
So, but I don't know in terms of scientific capabilities of steps you would have to take to do that. I just don't know.
And you really don't want to speculate if we don't.
No, I mean, I really don't know about it.
Yeah.